The patient's 71 years old. He's been battling lower back osteoarthritis, as well as spinal stenosis, so chronic nerve compression. Lots of pain, difficulty walking. He also can't stand very straight, so he tends to stand with a bit of a hunched posture, and that comes about because of the advanced arthritis that he has. So he has a couple things going on: bad arthritis, bad spinal stenosis, and a postural problem, a spinal deformity. So to accomplish all three of those goals simultaneously with an off-the-shelf implant is a bit more work, it's a bit more risk, it's a bit of a longer operation. We oftentimes have to make the patient fit the implant. With the aprevo personalized system, we're able to design an implant that fits the patient. It's designed to match those irregularities. You have curvatures or different shapes in the end plates themselves, which are not right angles, which are not plane shapes. And that's meant to fit into the spine like a key in a lock. The idea is that this should fit into the patient a lot better. So from a workflow standpoint, when we identify a patient who may benefit from the aprevo personalized spine implant, we send their x-rays, we send their CAT scans to Carlsmed, which is the company that provides this technology. They will take that information and they will actually render a model of what the patient's spine looks like. This is a three-dimensional model that we're then able to manipulate and look at to sort of see if we can get a better understanding of what the patient's pathology is, what their problem is right now, right? So then, in addition to the actual current state, they will create a plan for us. And they'll give us an idea of what we're trying to accomplish, for example, with these implants. So we're trying to gain height, we're trying to get alignment better, and we can go back and forth and look at the before and the after to see how much postural correction we're getting. Blue is before, the white is after. So for this patient in particular, stage 1, which is today, is the anterior lumbar fusion done through the abdomen. That's where we'll go in and we'll be utilizing the aprevo personalized spine implant system at the very bottom of his spine. So this is the L4, L5, and S1 segment. That's today, and then in a couple of days, we'll bring him back to do the second operation, where we'll go in and remove all of the stenosis, so all the areas of compression will be removed, and then we'll be placing screws and rods into the spine to help stabilize and further realign his spine. From a standpoint as a surgeon who's been in practice for almost 20 years, when we see technology that is really innovative, that really is solving for very specific problems for a really challenging group of patients, those with chronic lower back problems, for example, it's a really exciting thing. And then to be able to offer those technologies to patients through Northwestern is fantastic, right? It sort of is the clinical application of the research and innovation and education that we do at Northwestern. So it's a fantastic thing for us to be able to offer this to patients, and it is not something that most centers in the country are offering. We're one of a few places in the entire country, let alone in the Chicagoland area, that's offering this technology to patients. This reflects where we're going at Northwestern with regards to AI-driven care, with regards to hyper-personalized care, with regards to innovation in those spaces, and it's a really good example of that. I think that physicians should refer their patients who have spinal conditions to Northwestern, to our team at the Northwestern Center for Spine Health, because of a combination of a few factors. One is we have deep expertise, both orthopedic spine surgery and neurosurgery, as well as non-surgical specialties working hand in hand every day. And that's a really unique thing. Second thing is we try to create some simplicity for patients. So spine care is really complex, it's really fragmented. What we try to do by working together as a team here is remove some of that complexity and make things a little simpler for patients. And then the third reason is that we have access to and the ability to apply really innovative technologies to patients to try to bend the recovery curve down, to try to take risk, not out of the equation, but down in the equation, and to try to get people back to a more normal sense of living and life at a faster pace.